Hey everyone, it's Kim Nanaga, registered dietitian and the founder of the VIP Weight Loss System, where we help women 40 plus balance hormones and finally feel like themselves again. Today we're diving into one of the most common and confusing topics I hear about, thyroid health and GLP-1 medications. I want to explain to you what your thyroid actually does, how thyroid hormones work, how extra body fat can impact your thyroid, and how GLP-1s can actually be used safely and effectively when supported properly through nutrition and lifestyle. So, whether you've been told that you have hypothyroidism, Hashimoto's, hypothyroidism, nodules, partial thyroid removal, or even thyroid cancer, this training is for you. Okay, so let's dive into what the thyroid actually does. Okay, so think of your thyroid as a metabolic thermostat. It controls the speed at which your body burns energy. Okay, your brain focuses on a hormone called TSH. That's the signal to your thyroid. Okay, your thyroid makes mostly T4. This is a storage form of this hormone. And a little T3 is your active form. Okay, so T4 is the storage form and T3 is the active form. But here's the key. T4 has to be converted to T3 in order for you to actually feel energized, burn fat, think clearly. And guess where this conversion happens? In your liver and your gut. Okay, so I know that's a lot of science, but it's important that you understand this because if your digestion is sluggish, if your liver is overloaded, if you're under eating protein, that conversion slows down. Okay, so again, we're getting to the root cause of why this happens. So you can have normal labs, but still feel tired, cold, foggy, and stuck. So now what I want to do is go into the science of fat and thyroid function. Okay, so again, this is a training. You might have to watch it a couple of times, but I'm trying to lay this out for you. Okay, because here's something that most women don't realize. Keeping an extra 20 pounds of fat on your body actually changes the way your thyroid behaves. That's a big one. Fat tissue releases hormones like leptin. Okay, this is your full hormone. Okay, so it tells the body stop eating, I'm full. Okay, but fat tissues release those hormones. Okay, but they release inflammatory cytokines, and these can actually slow down thyroid conversion and push the TSH higher, even when the thyroid gland is fine. Okay, so research shows that women, when they lose weight, especially in a healthy, supported way, losing fat specifically, which is what I focus on, that TSH often drops. Okay, and the thyroid it improves. Okay, the efficiency, thank you, of the thyroid improves. And what does that mean? Energy increases. Okay, so holding on to that extra weight is not just about cosmetic issues anymore. It is literally a hormone issue, and it plays a huge role in thyroid function. Okay, so let's understand GLP-1s for a minute and how they kind of come into play with this. Okay, so GLP-1 medications, there's so much fear and misinformation around them, okay? Rightfully so, especially for those with thyroid concerns. Okay, I recently talked to our medical director, Dr. Melissa Ramsey here at VIP, about this exact question. And I asked her, I said, can you take a GLP-1 if you have thyroid issues? And her answer was clear. The only people who cannot and should not take a GLP-1 are those with a rare thyroid cancer. okay? And we screen for that. But if you have hypothyroidism, hyperthyroidism, Hashimoto's, nodules, partial thyroid removal, you can take GLP-1 safely, okay? And this is what I want you to hear. With the VIP weight loss system, number one, we go through all of this together with you. So you have an expert peptide weight loss medical director, plus you have myself, which is the registered dietitian. But we pair GLP-1 safely together with a system, a nutrition system. So number one, we keep the GLP-1s at a very, very, very low dose. So most of our clients, I would say 95% of my clients do not go past the starting dose. So the trial dose, the starting dose that you are given, almost all of my clients stay at that level and get these results. Because in the VIP weight loss system, we are really working hard at supporting your gut and your liver, okay? And I want you to hear this. We do this not with supplements, okay? We do this with lifestyle and nutrition and habits, okay? And it becomes an incredible tool for restoring hormone balance, improving insulin sensitivity, and helping your thyroid. The difference is in the approach, all right? Because if you're just taking the GLP-1 on its own, you're not going to get the same benefits, okay? So we don't just give a medication and hope it works. We support your entire metabolic system. Okay, so at VIP, every client's health history, lab work is reviewed by both Dr. Melissa and myself. Together, we build a personalized plan that supports your thyroid, your gut, and your liver while using real food and lifestyle strategies to balance your hormones naturally. Okay, we look at how your thyroid hormones are being produced, how they're being converted, and how your body is detoxifying. Because weight loss without healing just leads to burnout. Okay, hear that again. Weight loss without healing leads to burnout. But when we heal while losing, the results last. Okay, because almost every single client that I talk to says, Kim, I want to lose this weight, but most importantly, I want to do it sustainably. I want to maintain the results. Like, absolutely. So let me give you an example. A client like Leah. Okay, she's living proof. She lost over 30 pounds. Her doctor took her off her thyroid medication. Couldn't believe it. And she's been maintaining it. I checked in with her not long ago, and it's been over 18 months, and she is maintaining her results. But she was hesitant. She was so hesitant before starting the VIP weight loss system. But once I broke it all down for her and showed her how we're going to help her heal her body with a comprehensive, professional, expert approach, she said, let's give it a try. And she's sure glad she did. So if you've ever said, my labs are normal, but I still feel off, this is your sign. Okay. Inside VIP, we help women restore thyroid, gut, liver health so that your body finally works for you again, not against you. So if you'd like to see what this could look like for you, comment thyroid, send me a message. Let's do a reset. Okay. What we can do is with myself or one of my highly trained expert coaches, we will set up a complimentary call and go through metabolism and hormone review and look at your symptoms, labs, health goals. And then from there, we can build your game plan for healing and success. And then you can decide if it's the right fit for you. Because again, this isn't about chasing quick fixes. And if you want a quick fix, this is not for you, okay? But this is about healing. This is about understanding your body so that you can feel balanced. You can feel like yourself again, and you can create results that last.